Hello, my name is Venus Washington. I'm the advocate for the Black community. I am so pleased to have Dr. Ryan Restegard. Would you like to introduce yourself, please?
Yeah, I'd be happy to. Thanks, Venus. It's nice to be with you and answer questions today. My name's Ryan Westergaard. I'm an infectious disease doctor. I work and live in Madison, Wisconsin. I'm a faculty at the medical school, and I also support the state health department as the chief medical officer for communicable diseases.
Thank you so much. So I'm gonna jump right into my questions. So what percentage of the Black community has been vaccinated?
So that's a good question. I have the answer handy, but I think in addition to that, if we can do the screen share, I'll show you where you can find these statistics. So the answer is 20.1%, and I'll show you how I know that if we can do the screen share here. This is the Wisconsin Department of Health Services has our this is the homepage, dhs.wisconsin.gov, and always, for the past year, the top line on our website has been COVID-19 data. So if you go to the COVID-19 section, and then over here with our data pages, go to the vaccine section, it shows a summary of what we've learned from the vaccine distribution process. So all vaccines have to, when they're given to a patient or at a clinic or health department, wherever, get logged in a system called the Wisconsin Immunization Registry. And we've summarized the data for where and in whom vaccines have been distributed down here at this table. And it shows, unfortunately, similar to a lot of our data tabs, that the Black community has received less vaccine than white residents or Asian residents. So it's another example of disparities or inequities in our health system that we struggle against and need to fix. But these answers up as of today are here. So this says that 20.1% of Black residents in Wisconsin have received at least one dose as of today, and this gets changed in real time as more vaccines are given. I'll stop my sharing it.
Thank you so much for providing those resources there. That's very benefit for us. That's a big benefit. Yeah. So another question, how is the state of Wisconsin working to ensure Black communities have access to vaccines since we're so low in getting it?
Yeah, well, we try to work on the, I'd say more on the supply side, making sure vaccine is available, and also on the demand side. Like, we want people to feel comfortable asking and requesting and trusting that the vaccine is beneficial as we say it is. So on the supply side, right now, all COVID-19 vaccines come from the federal government. They purchase essentially all the vaccines and they make them available to state health departments. And that's our role at DHS. And so what DHS in Wisconsin has done, even since before we had vaccines, is we've engaged and supported and provided technical assistance to providers to give vaccines. And some of these are traditional providers and medical clinics, some are health departments, and some are pharmacies. And then there's some organizations that are new, like job, in places of employment. So the team, the task force at the state health department has tried to preferentially support and make sure that vaccines available to the zip codes, to the communities where access to healthcare has been lowest, and make sure that they have access to treatment. Another thing, we've used federal resources through FEMA, the Federal Emergency Management Agency, that has gone into the city of Milwaukee, where Black communities have had traditionally lower access to healthcare, and they've set up new federally supported community vaccination clinics in Milwaukee. So we're trying to make vaccine available in as many places so people don't have trouble accessing it. But that's probably only half the work. The other half is the kind of the work that we're doing right now, is how do we talk to people in our community about the benefits of getting vaccinated. because just having a vaccine available doesn't mean that large numbers of people in the community are going to get it. They have to trust that the vaccine is safe, that what they hear about it from people in health departments or their providers is relevant for them. And I think part of that is having conversations like we're having and trying to make sure that they understand how vaccines were developed, what the science says, and why we recommend what we do. And so I think that's an important part of the process as well.
Yeah, building that trust is important. Another question. So the Black community has been disproportionately affected by the severe COVID-19. What sort of measures have been taken or programs implemented to help reduce the numbers of hospitalization and deaths in my community?
Since we're talking about vaccines, I think that's a good place to start. The vaccines are our best tool, probably our most effective strategy for preventing illness. And through the two ways that I just mentioned, we're trying to make sure that vaccine is available and accessible in communities that have been hard hit by COVID-19 hospitalizations. So making the vaccine clinics available in communities, particularly for people that don't have access to a regular source of medical care. So that's the FEMA site in Milwaukee and other non-traditional sites like pharmacies where people can get a vaccine without an appointment now and without needing to have insurance. So making vaccines easy to get is part of it. And the other thing I think worth mentioning is we've made sure that the clinics and the providers that are working with the Black community don't have any shortage of vaccine. And again, this is only a piece of the puzzle. But for example, federally qualified health centers in Milwaukee and other places, when they request the vaccine to provide to their patients, they get 100% of what they ask for, because we want to make sure, we want to try to give these traditionally hard hit communities some preference, some priority if we can. And that was one mechanism to do that, was to make sure that the FQHCs, the clinics that serve the communities, at least get to the front of the line as much as possible in getting the vaccine that they request. It doesn't solve all of the problems, but it's but at least we can take off. We can not make it we do the best we can to make sure that vaccine's available.
All right, thank you. That did answer all my questions. I have one more about the ability to choose what vaccine, but you covered that. So thank you so much for your time, and we appreciate your work.
Okay, happy to be here.